You're watching this video because a doctor wants you to understand what's involved in a microvascular decompression of the glossopharyngeal nerve. This is surgery for glossopharyngeal neuralgia. You'll be positioned on your back or side, and a metal head clamp may be used to hold your head safely. Some of your hair will need to be cut or shaved behind the ear to prevent infection getting into the wound. How much hair is removed will vary depending on the personal requirements of your operation. To begin, your surgeon will make a cut in the skin of the scalp behind the ear. Special drills are used to make a hole in the skull. They're designed to stop if they reach anything soft. A larger bone window is then created. The incision and bone window will vary in size, shape, and position depending on your personal requirements. In this video, we show a smaller than average bone opening. Most are larger. The tough lining around the brain, known as the dura, is then opened to reveal the brain and cranial nerves. The surgeon will then carefully navigate to the affected nerve and inspect it carefully. If they encounter a vessel touching the nerve, they'll free it and place a small sponge made from Teflon or similar soft material between them. The idea is to prevent the pulsations of the vessel from triggering pain in the nerve. To finish, the surgeon may leave or replace some of the removed bone. They may partially or completely cover the defect with a metal plate. The healing process will fill some of the gaps left behind, but there may be permanent small bumps that you can feel. This is usually, but not always, covered up by the scalp and hair. The surgeon will then close the scalp with sutures or staples. There may be a drain left in place to drain off excess fluid from the surgical site, which will usually be removed in the first few days after surgery. You will have a wound dressing and may have a head bandage applied as well. The contents of this video are a general depiction of this procedure and the risks involved. It's not necessarily accurate for your personal situation. Information specific to your individual circumstances is listed in the written consent information sent to you by your healthcare team.